11 years. The CDC just put out a report today that said there's been no decline in incidents of HIV infection in young Black and Latino gay men. This fills me with fury. It is an outrage that we have had effective pre-exposure prophylaxis for HIV since 2012, and that less than 23% of the people who need it are on it. It's an outrage that the racial disparities in access to prevention, treatment, care, and quality of life remain almost as bad as they were before the plan. Today, a new smart man in the White House, well, maybe not that new, put out another plan with also some good sounding words in it, supposedly building on the last two plans. Again, there's no new money in it, but there's some good stuff in it about addressing stigma and discrimination and removing insane, unscientific laws that criminalize HIV transmission. But once again, we're going to have to do a lot of activism, both here at the city and the state level, nationally, and around the world, to force the political will that's necessary to get our leaders to do what we have known for the last 40 years was needed, which is take political action to save our lives. And in the last 2 years, we've just seen once again how many of our country's leaders and even many of its people don't care about people of color. They are racist, they are sexist, they are homophobic, they don't care about homeless people, they don't care about immigrants, they don't care about transgender people, drug users, the incarcerated, etc. We're a group that has been working together for the last few decades to try to end this. And it's my very great pleasure now to introduce my spiritual guide, my partner in crime, and one of my great heroes in the pandemic, the Reverend Dr. Charles King.
Mark, I didn't know you were going to recount that whole story, but it is a great story. And just to follow up on that, Mark and I followed up our time in jail together at what's the name of the restaurant? Grand Central Oyster Bar. And over oysters and martini, actually put in place how we were to go about bringing Governor Cuomo to commit to ending HIV as an epidemic. Started organizing a coalition, which many of the organizations represented in this room became a part of. And of course, we know that in June of 2014, Governor Cuomo announced a commitment to ending HIV as an epidemic in New York State by 2020. And with that, appointed a task force that developed a blueprint for how we would do that. We presented that blueprint to the governor in April of 2015 and have been working to put it in place ever since. While the governor made his commitment to do it, he never fully funded it. And as a consequence, we have not been nearly as successful as we would like. However, I do think it is important to note that we, in 2019, achieved an important milestone when not only having reduced the number of people dying of HIV-related causes, but having reduced the number of new infections to the point that with all-cause mortality for people with HIV, we actually had more people die than we had new infections for the first time in nearly 40 years. New York had fewer people living with HIV, which is an important step. 2020 set us way back, and we don't really know quite where we are, but I'm actually here tonight to tell you some good things that have happened just in the last few months and even in the last few days and weeks. So I want to start out, first of all, by congratulating our new governor, Kathy Hochul. And I want you to know that in just the few months that she's been in office, she's done some pretty important things that I want to share with you. And that's important for you to hear because later on, after we have some of the government officials speak, We're going to have some folk from the community talking about what our budget and policy agenda is for the state for this year. And we're going to want to hold our governor accountable, and she's got some representatives sitting here in the room, and we're going to want to hold our legislature accountable to really move us forward towards ending the epidemic. So I want to tell you some of the important things that we've achieved so far under our new governor. First of all, and I know a lot of you were involved in helping to make this happen. Today was the first day that Mary Bassett took office as New York State's health commissioner. That means we now have a health commissioner who truly believes in ending the epidemic, has been a strong ally of our community, and truly believes in harm reduction as the way that we achieve that goal, and also very strongly believes in addressing disparities that are based on race, ethnicity, and other conditions. The second big accomplishment, similar to that one, is today was the first day in which Chinazo Cunningham began her new role as the commissioner for the office of, they changed the name now, so for OASIS. So for the first time in the history of OASIS, we have a commissioner who believes in harm reduction instead of abstinence as the way to address substance use disorder. And I want to announce that on the 15th, on the evening of the 15th, the New York State Harm Reduction Association is going to be holding a town hall to which all of you are invited, in which we want to develop a concrete set of recommendations for her, including how she should spend $50 million in federal funds investing in harm reduction here in New York State so that we can really ramp up what we're doing. And that's super terrific. I can't announce a name because I've been told I'm not allowed to, but I do want you to know you should look out because in the next week or so, I believe the governor is going to be announcing a new commissioner of OTDA. This is somebody who's probably familiar to many of you, and I think we're going to have commissioners in 3 very important agencies that are critical to ending the epidemic, who are committed to transformation and progressive change in New York State government. And I think that's really remarkable. And I think we should all be very pleased and proud because I know a number of people were involved in encouraging the governor to make those appointments. I also want everybody to know that I think it was October 23rd, the governor signed 5 pieces of legislation. So last year, the legislature passed a number of bills addressing issues impacting on people who use drugs. Those bills had languished on Governor Cuomo's desk, and on October 23rd, Governor Hochul signed those bills into law. And I just want to tell you what they are. One is that it's actually illegal to have Narcan or naloxone in possession, and one of those bills made it legal for anyone to carry Narcan and naloxone on them. The second bill created a statewide online registry so that anyone can go online and find the nearest location to purchase naloxone or naltrexone. Very important. Third, and this is something that I've been fighting for 30 years now, for the first time, the governor signed into law a bill that decriminalized possession of syringes. Imagine, New York State will have more syringes than any other government in the world, and yet it was criminal to have those syringes in your possession. So for the first time, that's no longer the case. The other 2 pieces of legislation mandate that medically assisted treatment for people suffering from opioid use disorder be made available to people in prisons and jails. And the last expanded the number of crimes, the types of crimes of which somebody was convicted, where diversion into treatment could be used as an alternative to incarceration. So that's been a tremendous success. One more thing I want to tell you is that yesterday, the governor committed to expanding the ending the epidemic effort to 2004, fully funding that effort in her budget until that time. So that's really great. I just want to mention two important things that have happened here in New York City. You all may be aware that last year, this summer actually, City Council passed a bill that so if you're homeless, you're eligible for a housing assistance voucher, but that voucher has always been paid at 85% of the fair market rate. So if you can only afford to pay 85% of what the apartment costs, how many people are going to get housed through it? Zero. Exactly. Well, so City Council passed legislation that took the fair, that authorized payment above the fair market rate, 108% of the fair market rate, which is also what Section 8 pays. Well, we supported that, but that actually put people in HASA at a disadvantage because it's very hard to get HASA to pay even the fair market rate. I want y'all to know that C-Banks called me today, and he said that he had decided, this is World AIDS Day, and his parting gift, you all know he's stepping down as commissioner, his parting gift to the AIDS community is that HASA, it will now pay 108% of fair market. And then one last thing that I want to note is that after 2 years of saying that he couldn't do it, yesterday, Bill de Blasio, our mayor, authorized the operation of overdose prevention centers. And we now have two of them operated by On Point, Washington Heights Corner Project and NYS, one in Washington Heights and one in East Harlem, open and running. They opened up yesterday. Now, let me tell you what happened when they opened yesterday. By 3 o'clock, over 70 people had been in those facilities to safely inject. But here's the important thing. In each of those facilities by 3 o'clock yesterday afternoon, they had reversed one overdose. That's 2 people who would have been dead if we didn't have those facilities open. Now, Housing Works, I know we're assuming our landlord approves, we're planning to open one in Midtown in January. I know Hochul is working on getting one open up in Brooklyn. But the truth of the matter is, we need more than just the mayor authorizing this. We need the governor to allow Mary Bassett, who I know is more than ready, willing, and able, to sign an authorization that would allow all of these pilots to open and even to expand them. And so one of the things we're going to be urging all of you to do is to help us organize to persuade our governor to take this one more step and allow us to have overdose prevention centers around the state. And I'll shut up with that. Thank you so very much.
Awesome. Thanks, Charles. Now I'm going to introduce 3 virtual speakers. The first, Charles mentioned it before, but Dr. Mary Bassett is an extraordinary public servant. In between being New York's health commissioner and coming back and being New York State's health commissioner, she ran the FXP Center for Health and Human Rights at Harvard University. She came back to New York because we need her so much. You may know this, but when she was a young future MD, she was a Black Panther in the Boston area, working on lead paint, serving breakfast and getting healthcare for kids in Roxbury. I don't know if we've ever had a Black Panther in our state as our state health commissioner, but we do now. She's also a humanitarian who spent over 17 years of her life working in Zimbabwe, right after that nation became independent, helping build its health system after colonialism. I'm just going to introduce all three because then you can just watch them. You don't have to listen to me. The second speaker is going to be our new governor, Kathy Hochul. Charles already told you about some of the stuff she's doing and some of the stuff we're going to need her to do. But it's also the first time in New York State history that our state leadership is all women or people of color or both. In the Assembly, in the Senate, in the governor, and the lieutenant governor. And then the next speaker is our new mayor-elect Eric Adams, the second African-American to become mayor of our great city. So without any further ado, let's go to them, and then we'll come back to us. Thanks.
Good afternoon. I'm Dr. Mary Bassett, New York State Commissioner of Health. This is my first day in this new position. I'm incredibly grateful to address this afternoon's community town hall on such an important topic, ending the epidemic in New York State. We have community members from across the state tuning in virtually for this town hall. I'm talking to you from Albany, New York, and there are also people who are participating in person at the LGBTQ Center in New York City. I'm sure many old friends of mine are there. And all of us are here for the same reason, to call for a continued commitment to ending the epidemic in New York State. And I'm here to tell you that New York State, and I personally, are committed to sustaining the gains that have been made and maintaining the momentum that was reinvigorated in recent years. 2013 was the year that many of you signed on to a letter calling for the New York State government to show political will and fiscal support and public health vision in prioritizing significantly reducing new HIV infections and diagnoses. I was the New York City Health Commissioner at that time, and I hold this up as an example of a really good collaboration between the city and the state, one that I hope becomes an exemplar for work ahead of us. And now New York State recommits to ending the epidemic efforts through 2024, with outcomes measuring ET progress available by December of 2025. We believe that this is the amount of time it's going to take to achieve the remaining goals following the impact of another epidemic, the COVID-19 pandemic, and the effects it had on individual access to prevention, services, treatment, and support. So as the new New York State Commissioner of Health, I'm really proud to rejoin you in the efforts to move our state forward with an increased emphasis on reducing inequities that persist in our state. In 2019, New York State successfully bent the curve, achieving a reduction in HIV prevalence for the first time in state history. And we did so, but we did it with continued disparities. I applaud your tremendous work and commitment to achieving this goal. However, I challenge each and every one of us not to accept the very large disparities that disproportionately place the burden of HIV/AIDS on Black and Brown communities. I'm also pleased to announce the public release of the Ending the Epidemic Addendum Report. That's kind of a mouthful. And this is an addendum to the original Ending the Epidemic Blueprint. The addendum presents key themes and outcomes informed by feedback received from key stakeholders throughout 2020, achieved despite the COVID-19 pandemic, and is highlighted in this report: health equity, the social determinants of health, and addressing racial disparities will be the central focus as we move forward. 23 statewide community virtual listening sessions and online survey provided opportunities for stakeholder discussions to identify outstanding needs and increase areas of focus for ETE efforts beyond 2020. New York State has also recently released the Hepatitis C Elimination Plan, renewing the state's commitment to eliminate hepatitis C by 2030. The Hepatitis C Elimination Plan works to ensure that those living with hepatitis C receive treatment and those at risk have access to harm reduction services while addressing barriers, keeping individuals from care. The hepatitis C elimination plan was developed by the New York State Hepatitis C Elimination Task Force with contributions from more than 125 workgroup participants. While we seek to maintain current efforts to end the epidemic, community involvement has been and remains a top priority. We have formed extraordinary partnerships with consumers, service providers, community leaders, advocacy groups, research entities, federal, state, and local government agencies. Together, these have made the ending the epidemic momentum and the development of the hepatitis C elimination plan possible in New York State. So I'm very proud to rejoin you in this important work. It's really wonderful to be back in New York. Thank you for the warm welcome. I look forward to our work together.
Hi, I'm Governor Kathy Hochul. This World's AIDS Day, we remember the people we've lost to the disease and reaffirm our commitment to working toward an AIDS-free generation. We've made tremendous progress combating HIV and AIDS through education, a commitment to life-saving treatments, and unwavering support from thousands of organizations around the world. But our work to end this serious health threat is unfinished. As of December 2020, more than 105,000 New Yorkers were living with diagnosed HIV. In 2020, the rates of new HIV diagnoses among non-Hispanic, Black, and Hispanic individuals were 8.1 and 3.9 times higher, respectively, than the rate for non-Hispanic white individuals. We must continue to educate communities on the importance of testing, treatment, and continue to fund AIDS and HIV research to pursue scientific breakthroughs, prioritize our most vulnerable communities that are still being hard hit, including gay and bisexual men, Latinos, and African Americans. And we must continue to support individuals living with this disease. My administration is fighting to ensure all New Yorkers have adequate and comprehensive health care for all. I recently announced Dr. Mary T. Bassett as the Commissioner of the New York State Department of Health. Dr. Bassett is a steadfast fighter whose leadership and experience will drastically improve health equity and access across the state. As we continue the fight to eradicate AIDS, we must address the social challenges that prevent marginalized New Yorkers from access to health services. We will leave no New Yorker behind in this fight. As your governor, I'm committed to ending the AIDS epidemic in New York. We will do this together as partners, and we will not quit until the job is done. Thank you.
Crises like COVID. Sometimes we get over-consumed when we're facing a crisis like COVID pandemic. But we must remember that we have an epidemic that's still among us, HIV. We are committed to renew our spirit and energy to ensure that we combat HIV here in the city of New York. We have lost over 100,000 New Yorkers who have died due to HIV and AIDS. We have over 100,000 New Yorkers who are living with this epidemic. I say to you, as the incoming mayor of the city of New York, I'm going to recommit myself to ensure that we fight against HIV and AIDS and ensure every New Yorker who are experiencing this disease receive the support that they deserve. That is my commitment to you.
Thank you, city and state officials. Can you hear me? We now have an extraordinary group of ending the epidemic community leaders who are going to talk about some of the community demands for the next iteration of our state and city efforts. I'm going to introduce them all sequentially now, again, so that you can spend more time listening to them and their insights. Kimberly Smith, whose pronouns are she and her, is a valued ally and colleague who's been working in the trenches for many, many years. She is the Senior Director of Public Policy and Advocacy at the Callan Lord Community Health Center. My friend Jackie Kilmer, whose pronouns are she and her, is the Chief Executive Officer at Harlem United. Luis Scacabarrozzi is the Vice President of our close ally and very good friends at the Latino Commission on AIDS. Originally, the Executive Director, Guillermo Chacon, was going to be here today, but he was detained by an invitation to the White House to attend the launch of President Biden's rebranded ETE. We wonder what kind of conversation he's going to have with the president. And finally, Wilfredo Morel, also he and him, is the Vice President for Migrant Health at Sun River Health, which serves migrant workers in the Hudson Valley, and who, as we all have become extremely aware in the last 2 years, represent part of our state's essential workers and communities, and yet are so often left behind. They're going to address some of the community demands related to the social determinants of health, of racism as a public health crisis, and many other issues. So please welcome first, Jackie.
Thank you, Mark. Good evening, and thank you all for being here on this World AIDS Day. We've heard that we've made significant progress in implementing the recommendations in 2015's Ending the Epidemic Blueprint, yet that progress has not been uniform across all regions of New York State, nor has it been uniform throughout all communities. Upstate and Long Island still lag behind New York City in terms of improved health outcomes for people living with HIV and people at risk for HIV. And across the state, unacceptable disparities persist in HIV's impact on Black, Indigenous, and people of color. The COVID-19 pandemic just further exacerbated these inequities and severely impacted the progress we were making in ending the epidemic. Each year, the End AIDS New York Community Coalition puts together its budget and policy priorities for the current budget and legislative sessions. On this World AIDS Day, the Community Coalition calls for renewed commitment and substantial financial and political investments that are necessary to fully implement the ETE blueprint recommendations and to end the HIV/AIDS epidemic for all communities throughout New York State. We'd like to thank the Governor, Mayor-elect, and Dr. Bassett for renewing their commitments to end the epidemic. And as Charles mentioned in his opening remarks, we've already won a couple of our policy demands, so we're off to a good start. By now, there can be no question that the challenges posed by homelessness and housing instability, food insecurity, lack of employment, stigma, and other social and structural factors drive inequitable access to HIV testing, prevention, and care. But we also know that effective intervention to address these factors significantly improves HIV health outcomes. As part of the coalition's state budget and policy priorities, we're calling on the state to recommit to end the epidemic by addressing housing access and other key social determinants of health. To address housing inequities, we need to provide equal access to meaningful HIV housing supports across New York State. Over 4,000 households living with HIV outside of New York City remain homeless or unstably housed because the blueprint recommendations to ensure access to safe housing have not been implemented upstate or on Long Island. In order to address this disparity, the state must do the following things. It must amend the regulations governing the HIV enhanced shelter allowance to set the rent payment standard for the program to at least 110% of HUD FMLI. It needs to make the New York City only HIV affordable housing protection available statewide to cap the share of rent for low-income people with HIV at 30% of disability or other income. It must require that each local Department of Social Services provide all income eligible people with HIV access to HIV enhanced shelter allowance and the 30% rent cap upon request and application. And it must provide New York State funding to reimburse 100% of the cost of the HIV enhanced shelter allowance and 30% rent cap in local departments of social services outside of New York City. It must also increase the value of the New York State FEPS vouchers. So the State Family Homelessness and Eviction Protection Supplement Program, or the State FEPS, is one of the key programs to address unmet housing needs. The current maximum rent level for the program is 85% of FMR, which is woefully inadequate and results in low-income families being excluded from the housing market entirely or being forced into substandard and unsafe apartments. The state must increase the maximum rent level for state FEPS vouchers to 110% of FMR. This is especially critical now as more families have experienced hardship or eviction due to the ongoing pandemic. To increase HIV testing so more people know their status as early as possible, we must mandate HIV testing on an opt-out basis in all licensed Article 28, Article 31, and Article 32 facilities. Data across New York State shows that the rates of concurrent HIV and AIDS diagnosis remain unacceptably high, especially among New Yorkers who may only interact with the healthcare system through emergency department interactions or with other institutional settings. It's past time to amend the HIV testing law to facilitate true opt-out testing protocols with meaningful patient education and the opportunity to decline testing, to require that all licensed facilities employ opt-out HIV testing, and to make available technical assistance or consultation from the New York State Department of Health AIDS Institute to assist with the development of opt-out testing protocols and educational materials. To improve prevention, treatment, and care of STIs, we need to broaden at-home STI testing. STIs are projected to continue to increase across the state, in part due to the impact of reduced access to STI testing during the COVID pandemic, during which many of the sexual health clinics across the state closed temporarily and reduced their hours. Self-testing technology has come a long way, but there are still barriers to its effective use. To facilitate home testing, the state must amend laws and regulations that create barriers to home-based testing services, such as physical examination requirements. In addition, a pilot project of at-home STI screening should be established and evaluated. We must also eliminate congenital syphilis in New York State by the end of 2030. Rates of syphilis in New York State continue to exceed the national average. We know that left untreated, syphilis can cause serious health problems and even death. But if syphilis is identified quickly, it is curable with common antibiotics. New York State Department of Health should be authorized to convene a statewide task force to develop comprehensive recommendations to improve screening, public and provider education, prevention, and care. And now I'll turn it over to Kimberly.
Thank you, Jackie. Hello, everybody. Can you hear me? All right. Hi, folks. I am Kimberly Smith. I am the Senior Director for Public Policy and Advocacy at Callan-Lorde Community Health Center. I have been a part of the End AIDS New York Community Coalition and the ETE Legislative Committee for all 6 years of its existence and for some years leading up to that. And I want to remind you all something that somebody reminded me in one of our calls recently is that the plan to end AIDS is a community plan, developed collaboratively, of course, with our partners in government, but generated by the community and all of you here. So it is amazing. It is amazing to learn today that our new Governor Hochul and Mayor-elect Adams and our new State Health Commissioner want to invest in and recommit to this plan. It's especially great to hear Governor Hochul has pledged to continue core funding for ending the epidemic through 2024. This is a testament to her leadership and commitment to this cause, especially as so many resources in the past year and a half have necessarily been redirected to the COVID-19 public health emergency. But our work is not done. I know you all know that. Our community know better than anyone that the plan must continue to focus on the key social determinants of health, like housing, as Jackie just spoke about. But what I want to lift up is this. We cannot end AIDS without centering our own sexual health. This has always been important, but as we adapt to this new normal, as people like to say, this new reality, still in the midst of a global pandemic, and in addition to the HIV epidemic, which is now 40 years old, we need to continue to elevate sexual health and sex positivity, and that has become even more necessary than ever before. We know that since the start of the pandemic, there have been increases in HIV cases in certain parts of the state. There have been significant reductions in HIV testing and decreases in the number of people accessing PrEP and record high levels of sexually transmitted infections. So while we look forward to continuing to work with the new governor and her administration on to sustain this core funding, we want her to work with us to meet these additional demands. And Jackie sort of alluded to one of these. The first one is expanding state sexual health clinics and capacity to provide PEP and PrEP. And we think we need $10 million to do this. Sexually transmitted infections are too often undetected and untreated and are linked to increased vulnerability to HIV. So we need to expand STI, hepatitis C, HIV testing and treatment, and access to PrEP and PEP by increasing the number of sexual health clinics in New York State and funding for PEP and PrEP, navigation at healthcare centers and community-based organizations, with a focus on increasing PEP and PrEP for communities like African American and Latina women, Asian and Pacific Islanders, and young adults, through telehealth services to reach those in rural communities. The second thing is a long overdue thing. We need to require LGBTQ+ cultural competency training for all licensed providers. We think this will take $1 million. In addition, we need to amend the education law to allow the commissioner to establish standards requiring that all people applying to obtain or renew a healthcare or related license or certificate of registration, they need to complete at minimum 2 hours of coursework or training regarding LGBTQ related healthcare and overall LGBTQ+ related cultural competence. And we want this to apply to not just doctors, but physical therapists, midwives, even your podiatrists and more. Yes, I said podiatrists. This is so important to combat stigma, to improve health outcomes, and to provide affirming, competent care, something that we all deserve. Another area we really need to focus on and demand is to expand women-focused HIV testing, prevention, and early treatment access to reach women who test positive for sexually transmitted infections, survivors, victims of domestic violence, and women leaving correctional facilities. We need to establish a linkage and retention and care program for women with HIV outside of New York City. And we think we need to invest $2 million to do that. So once again, we are thrilled that Governor Hochul has committed to the ETE core funding, which is essential to regain momentum and complete the work necessary to end AIDS as an epidemic and move closer to HIV health equity. But we need to push ahead to meet these other demands and an end to AIDS our reality. Thank you. Refer to it, but the AIDS Community Coalition and the Legislative Committee has put together a very robust legislative agenda. I think Jackie mentioned this. We'll make sure everybody has it. It is 7 pages long. You're going to hear some of the demands today, but not all of them. Thank you.
This is on first. I'm going to try to keep this short. I've been asked to actually speak about 3.
Can you use the mic all the way?
I've been asked to speak about 3 issues, and the first issue that I've been asked to speak about is how we expand here and other employment opportunities for people living with HIV. And so, some years ago, I had the chance to participate in some meetings that led to the some recommendations as a supplement to the blueprint and the epidemic. And so, I asked the question now, how many of those recommendations do you think actually were implemented? And I'm going to answer that question by giving the same barely none. And so that's the response. Most of these recommendations that were provided were to ensure that we were providing employment and job readiness, vocational services, peer workforce placement and establish peer workforce pilot initiatives. So again, very few of those recommendations were implemented. So we're looking forward, and the request for that portion of the NDA's academic blueprint is actually $4 million. And so that's what we're hoping to accomplish this time around. The other issue that I was asked to speak about is addressing HIV health disparities experienced by youth. And so we know that that there's been a disparate impact of HIV amongst all youth, mostly being by men, trans and gender non-conforming communities. And we want to make sure communities of color, of course, we want to make sure that we impact through the different recommendations these communities that have been highly impacted. So how is it that we want to do this? We want to make sure that there's increased messaging. We want to make sure that there's easier access to prevention, treatment, and care. And we want to make sure that the messaging reaches these communities at a much earlier age. And so through that, it's been divided in 4 areas. And we're requesting $22 million to create comprehensive sexual health education throughout all schools. And that includes public schools and includes the charters. And we want to make sure that kids between the ages of kindergarten all the way to 12th grade have access to comprehensive sexual health education. Make sure that they have information in regards to HIV prevention. And in this way, we reach the communities that otherwise would probably not be having this information. We're also requesting $2 million to create a condom use media campaign. We know that STI can be prevented, and the way of preventing it is actually by using condoms. And so there's been an increase of STI rates amongst communities of color, specifically youth, and we just want to make sure that these communities are reached. The other the third issue is we want to make sure that our LGBTQ youth receive priority funding to create safe spaces, safe havens throughout the state, and for that we're requesting $3 million. We know that technology has been something that's been really important during this COVID. This last year and a half is more than a year and a half already. And so we want to make sure that some of those lessons learned actually are implemented in the work that we're doing with HIV. So we want to make sure that virtual platforms, such as telehealth, telecounseling, teleservices are implemented, just to make sure that we reach as many people who need those services who have challenges through these services. I'm going to change the age range. It's the opposite as the older adults. Where we actually, at the end of 2019, we know that about 50% of all people living with HIV are older adults, people over 50. In 10 or 15 years, it's going to be actually more than 60%. I think that's going to be a great need for these communities that, and there's very specific needs that these communities have. We know that comorbidities present. We know that there's issues around mental health, a higher risk for depressive symptoms, and so many other issues that are very specific to this population. And so we want to make sure that these communities are reached with services that will be able to serve them. So I don't have anything else.
Thank you, everyone. Good evening, everyone. Indeed, it's a beautiful evening. My name is Wilfredo Morel, and I'm Vice President of Immigrant Health for Sun River Health, formerly called Hudson River Healthcare, Peekskill Ambulatory Care, and Peekskill Area Health Center. We are located basically in the beautiful Hudson Valley region, but also we have expanded, which is the reason why we're not just in the river, but we all over the place. So that's why Sun River is serving community health centers. Is a group of community health centers, approximately about 43 of us in county, serving over 250 patients around the state. So we are, believe it or not, we are the 3rd largest community health center in the nation. Although it is also important to say that today marking World AIDS Day. Okay, World AIDS Day. Going back to the 1980s, It is safe to say that yes, we can talk and we can share, we can basically bring population. But one population that for years has been basically off the radar has been migrant seasonal farm workers. And keep in mind that migrant seasonal farm workers is a word that also differentiates migrant farm workers, because there are those who migrate within counties and there are those who migrate within states and within countries. So a lot of what my colleagues have mentioned in terms of the ask, it is what we asking for them. Therefore, I don't want to go there. But I'm just going to tell you briefly, who are they and how many have in this community called New York City, New York State, right? I had to look at it as a New York State. So it goes like this. Total migrant farm workers population in the state of New York is approximately 75,000 right now in county. Out of that, 59,883 are counted for because they basically come as a H-2A, which is a visa program, and those who are hired by the Department of Labor, which is, by the way that we can get data and information about the community, because we still lacking data about migrant seasonal worker and HIV/AIDS specific. The other part of that is that the largest concentration of our migrant seasonal farm workers is Suffolk, right? Wayne County, Orleans, Chautauqua, and Franklin. We still have it in Dutchess, we still have it in Putnam, we still have it in the other upstate, which is Long Island. That's what we call it. But guess what? About 15 years ago, somebody came and said, you know, we can definitely make wine here. Guess what? The migrant came. They're there. And they're not any different. Now, what is the other situation here with our population? Is that migrant producers or farm producers in the state of New York each year, $4.2 billion in revenue. 4.2 billion just in farming, right? To support this country, to support the state. Now, what's the other part is how much do we get from the permanent health to support migrant farm worker health? 485,000 a year, in which, by the way, we have to advocate for that so that it can be flat funded. So you notice that I haven't yet included about services around HIV and AIDS and all that, because as a community health center, we are to serve the population regardless, and that's the reason why community health centers are very important when it comes to our community, because we go where the situation is. So we've been serving the population for over 30 years because they're here. The only way that you can learn about it is, one, if you live within the proximity, if you're one of those people who love to visit upstate, because remember, upstate, anything after Yonkers is upstate. Yeah. Seriously, Yonkers is Westchester. Let's put it that way. Let's keep it real. Therefore, when we talked about advocacy, when we talked about representation, it is extremely important, my friend, that we go beyond the $5. Because my friend, they've been here. They're here and they're here to stay. And guess what? They also are HIV positive. They also are LGBTQ, and it's harder for the population because while they had to travel, they had to really carefully plan. Now, what happened is that one of the greatest things that happened within the past 10 years was, number one, to me, an amazing, remarkable man, which is basically Charles King, who came and said, wait a minute, there is this guy who is working through this organization, through migrant farm work. What do they know about advocacy? And folks, we went not only from Westchester or from Putnam, we went from Putnam all the way to the Finger Lakes. We went from Spanish speaking, Creole speaker, and Bangladesh, because that is the community. to help them how to allocate. And that was how it works. And I thank you guys for that, because you guys went to us, came in the evening, went to other farmers, and did basically the trainings. So training, extremely essential and all that. And we do have some of you who are allies. The other piece that had happened is that in providing services for this population, it is the continuum of care is much harder than anyone, because remember, they're here just for the season. They're here from May all the way into October. And then from there, some go to Belleville, Florida, some of them go back to Haiti, or some of them goes back to North Carolina, or some of them just migrate between counties. But they're still here. They still represent a vulnerable population. So I think that my presentation was about, I guess, kind of a reverse racism or something around those lines. But what happened when a population like that is the inclusion, the lack of inclusion, not because they don't want to, but just because our communication is just so limited, because it only reaches just one group. And listen, I know that we're right in the city and we're secure because we don't network. But when you go to the upstate, when you go to the Hudson Valley, communication becomes a struggle, my good friends. So the communication needs to continue. I thank basically my colleagues here in the city and the Hudson Valley who said, no, we need you to come and tell the message. Lastly, we had the opportunity for the first time in the history, over 30 years of migrant health, to be invited to be part of the ETE. To be part of the ETE. That's what they said, no, we want that population to be present. We want to know about that. And we created the non-English speaking migrant workers, refugees, and new immigrants. Part of the event. That's wonderful. But somebody, one of my colleagues mentioned, what about the implementation? What are we going to do with this? How are we going to start it? And that's where we are at. Every effort, every advocacy, every conversation that we are to do collectively to our political leaders, it has to be about access. It has to be about not just saying the word, but about doing the job. We want to do the job. You want to do the job. It is true that we have to label ourselves, because you see, that's how grants works. That's the grants works. But one of the biggest issues that we have within the migrant seasonal farm worker is the lack of data. The data that I presented to you come from the national, right? But when it comes to the local data, we're still struggling. That is on the ETE implementation as one of the recommendations, as well as many other that were mentioned from not only realizing, talking about the language, what is the language, the culture, the religion, the tradition, all those things is what we call about the one, serving the one person, the in itself. So we had to include that into whenever we deliver services and all that. So I thank you so much for letting me tell you that story. We are, again, migrant seasonal farm workers are here. They're here to stay. You see them whenever that you're consuming any vegetables, any fruits, they're with you. And remember that they are a very strong, financial force in the state of New York. Thank you so much. Thank you for the opportunity, and may God bless you.
Wow. So first of all, thank you so much to our speakers, and thank you to everyone that's online, watching, and spending this time with us for World AIDS Day. I'll be very brief. I'm just going to introduce our final speaker, who's going to tell a bit of their own lived experience, and thank everyone for being here and really close us out. But before we move into that direction, we've heard a lot from very powerful people about the complicated realities of public policy as it relates to the AIDS crisis and subsequent related issues. We've talked about racism as a public health crisis. We've talked about the need for AIDS housing. We've talked about the connection between overdose prevention centers and responding to the issue of the AIDS crisis. So much of the work that we're doing together is intimately connected, intersectional, the language we get from Black feminist thought. So the reason I want to ground us again, and I know each of you in this space, each of you online, think about this. You contend with this reality because this is your life. These are our stories that we're talking about. We are talking about our people. Whenever we're talking about expanding AIDS housing statewide, whatever pathway we have to use to make that a reality, we're talking about people that we know. We're talking about our friends, our family, our siblings, the people that we serve. So what I wanted to remind everybody about today, and it's been said multiple times in many ways, is that we are building a movement. We are the fruit of people's work. We are the fruit of people's dreams. The AIDS Institute, the New York State Department of Health, the fact that we have syringe service programs in the state of New York, the fact that we have overdose prevention centers right now active in New York City, already saving at least 2 lives. That is only possible because we organize ourselves and we say to our governments that we run our governments, we elect those who have the reign over our money. It's our rules, and it's up to us. That's right. It's up to us. That's right. That blueprint, you did that. I was there. I watched it happen. I had no idea about harm reduction. I was just a young person, diagnosed HIV positive, and found myself living in a HASA shelter organized by Praxis Housing. And I learned about harm reduction. I learned about housing as healthcare. And one of the ways that I learned that so profoundly was attending an ACT UP New York meeting in this building on the 3rd floor, and Reginald Thomas Brown was in that space. Folks like Jason Walker in the room introduced me to HIV and AIDS as a social justice issue, not just an epidemiological phenomena that we have to respond to in a public health sense. So we're able to hold that complexity in a way that people like Reginald, longtime survivors, the way that they do that work. Reginald Thomas Brown is a board member and a leader in Vocal New York's Positive Leaders Union. Vocal New York is a statewide grassroots membership organization building the power to end AIDS, homelessness, mass incarceration, the drug war and its consequences, the overdose crisis, the hepatitis C crisis, and we have to build an economy and a democracy that works for those people that we organize in Rochester, Buffalo, Syracuse, Albany, Westchester County, and these 5 boroughs. So with that, I give you Reginald Thomas Brown. Please stay with us.
Good evening, everyone. I know that we have heard a lot of very hard data, a lot of very good news. If you can, I encourage you to stand up and stretch. Yes, get a good stretch, a good deep breath, because we've had a lot of very good information, but after I hear a lot of statistics before, I kind of pass over. But I mean, it's important that we know this and advertise it. Thank you. You may be seated. Before I continue, I must recognize the stolen land of the Lenape Nation upon which we stand. I also invoke the spirit of the ancestors. I am the answer to their dreams and the manifestation of their hopes. On this World AIDS Day, let's remember AIDS in New York State is not history. It's a lived reality. Nearly a decade ago, I attended the initial meetings that led to the then Governor Andrew Cuomo's in the epidemic in New York State by 2020. I was one of the many experts in that room. Thank you, Mark, and thank you, John, for your jail stint to do that. But we base this blueprint on our lived experiences. We are the experts. You are the experts. We know what we need. We know what we need. All we need you to do is give us the money to do what we need, but we know what we need. Don't give us something and say, use this. No. Ask us what we, in fact, no, listen, we will tell you what we need. Across every issue that we found, a common denominator was housing. Testing, treating, and preventing without housing don't mean shit.
That's right. That's
People who don't know where they're going to sleep, they're not thinking about medication, and they have no place to keep their medication. It's sad to say that in now 2021, the state still has not provided sustainable housing for all New Yorkers who are HIV positive.
Stand up, fight back.
That's right. I know that's right. And I was in this room, but I won't get into that. I am living proof that housing is healthcare and prevention. HIV has lived with me since August 1986. That's 35 years, 1 year longer than I've been HIV negative. As of today, my HIV cannot be transmitted because I have been undetectable since 2003.
All right.
Going local in New York in 2010 because they understood how big an impact housing had on my treatment. Before it was even part of the epidemic, the ET blueprint, we were fighting for all HIV positive income eligible people living in New York State to get enhanced rental assistance, food stamps, and transportation, regardless of how sick they were. In 2013, I stood with local leaders at the state capitol to deliver this message. I read the names of over 200,000 people in New York State who had been neglected due to government, who had been not served due to government neglect. I was arrested with 5 other people. One of them is still in the room, another person is not here. But we did this so that all income eligible people in New York State could get housing. Well, of course, of course, that governor, and what he does is, what he did was to split us. He gave New York City the funding, but the point is, it was his blueprint to end AIDS epidemic in New York State. Well, if everybody in New York State does not have what we have in New York City, it ain't gonna happen. So he shot his own blueprint in the foot. Previously in New York, previously in New York City, only people who had an AIDS diagnosis could get housing. That means if you weren't sick enough, you couldn't get housing. We realize how vast backward is that. The point is, if you're HIV positive, give the person housing so you can keep them HIV negative. Or you can keep them from seroconverting. The point is that, okay, all right. But again, he failed. I'm not going to talk about him anymore. Back in the States, it's a message to people living outside of New York. You don't care. You're not important. We don't care about you. How inhumane is that? This was one mean-spirited person, and I'm so glad. I'm so glad that he's gone. Every time I've been arrested, all we was due to his inaction. I was arrested for the overdose prevention center. So thankfully, New York City has that. Not only is HIV no longer a death sentence, but the stigma of HIV is more deadly than the symptoms of HIV. This legislative session, we can get rid of this discrepancy. There is currently legislation that state lawmakers can make right now that will help people living with AIDS across the state, not just New York City. It's called PATHS, Point of Access to Housing Services. I know that's right. Which would provide enhanced rental assistance, food stamps, and transportation. It is imperative that New York State lawmakers and the governor act now, because too many people are living in unstable housing. City lines should not define whether those living with HIV can get the care they need. And the zip code should not be a death sentence. Housing is not only a human right, housing is health care and prevention. So on World AIDS Day, We don't hope, we demand. We don't hope, we demand that our elected officials will recommit to the epidemic that is still alive and well in New York. Thank you very much.
People with AIDS are under attack. What do we do? When people with AIDS are under attack, what do we do? When people with AIDS are under attack, what do we do? When people with AIDS are under attack, what do we do? When people with AIDS are under attack, what do we do? When people with AIDS are under attack, what do we do? Thank you.
Thank you all so much for coming. That is it, but you know what? I'm preaching to the choir. Our work is not over. Our work is not over. And I know as long as it's breath in my body, I will be 70 on January 20th. And as long as it's here and has me and I have breath, I know that I have an assignment. About 10 years ago, I asked Creator why I was still here, considering so many people who were diagnosed in 86 after were gone. And she said to me, as clear as the bell, you need to go out so that people can see you and hear your story. Our story, your story, is the most powerful and valuable weapon that you have. Tell your story. Tell your story, because somebody is waiting to hear it. They won't hear it from me. They need to hear it from you. That's how important your story is. Even if you get bored telling stories, it's okay. Because I don't tell my story for me. I tell my story for that person who needs to hear it. And I may never meet that person, but that's not the issue. My assignment is to be seen and to be heard. So with that, I would say, let's go out and kick some serious ass and take care of what we have to do. Thank you.